agenda item 11 on the review of the Code of Practice for the reduction of acrylamide in foods. I'm Dr. Ghada Khdewi from the National Authority for Food Safety, representative on the Contaminant Committee. We will tackle several points. We will start with introduction, background analysis of Codex document, and at the end we will present the recommendations. Acrylamide is one of the contaminants resulting after heat processing, especially for the starch commodities when they are baked or fried or roasted at high level of range 120 to 150. It is carcinogenic compound in several food commodities. It has health concerns of high risk, especially for children and newborn when they are exposed to high levels of acrylamide. Based on that, the CCF has initiated work to address the concerns about acrylamide and to address a potential carcinogen found in foods. A working group was established to develop a code of practice to reduce acrylamide in food. As a result of the EWG, it started to build scientific assessment from different bodies like JACFA, IFSA. The main purpose was to, in the CCF, to harmonize risk management strategies in order to protect consumer health and facilitate global trade. Next. This slide clarifies the gradual steps that we tackled. Next. In regard to acrylamide from the very beginning, I'm tackling that in the Codex documents to make a summary. In the CCF18 in 2023, that was the establishment of the EWG, chaired by India and co-chaired by Saudi Arabia, in order to prepare a discussion paper on acrylamide in food and to be discussed in CCF17. Next, CCF17 in 2024, there was a support to revising the Code of Practice CXC67, contingent on further assessment of the new mitigation measures, and it was agreed that issuing a Codex circular letter to collect information on risk management and practices that would be better support the EWG and to provide data that are helpful for assessment. Based on that, the CCF decided to re-establish the EWG, headed by India and Saudi Arabia, to develop a discussion paper including a proposal for best practices and revised code of practice, and to issue a CL letter to collect information on a new risk management measures. The main target in CCF18 in 2025, the EWG will present their proposal related to develop of a discussion paper, including a proposal for revised code of practice. Next. When we try to understand the Codex document in details and most important points, based on which the acrylamide is considered a cancerogen impacting health. The main reason was talking about acrylamide is considered genotoxic and carcinogenic with health risks dependent on exposure level. In 2004, Jeffson workshop found that existing epidemiological studies lacked sufficient stats and data cancer risks to confirm the cancer risks at dietary exposure levels. Then, European Commission and JACFA have emphasized the need for more systematic and comprehensive studies on acrylamide exposure and its risks, based on which reported average exposure levels vary by country, with infants and children identified as the most vulnerable group. Based on that and the JACFA studies, the average dietary intakes result in margins of exposure that are generally of low concern, but the margin of exposure for high consumers, especially related to neurotoxicity that produce high acrylamide, they are exposed to health concerns related to neurotoxicity and carcinogenicity that was present in the people who have high dietary intake from acrylamide. Then JACFA and other bodies like WHO, EU made recommendations on the continuation of the work and how to reduce acrylamide in food and water, and highlighted the need for update toxicological data and emphasized the importance to assess the exposure in developing countries. Next. The analysis of Codex document was the final document in 2024 based on the scientific documents studied over the past few years and the team of experts in EWG. They clarified certain information about acrylamide. The most important information divided on several items. First, in regard to toxicologically and toxiconetics, acrylamide is one of the contaminants absorbed fast and changed to glycemide by an enzyme inside the body, but it is distributed widely in the body and impacts the genes, based on which it was reported of high toxicity in the neurosystem, or it is metabolized and makes a gene problem. There is difference in the human nature how to deal and treat these toxins based on the nature of every consumer. Toxicodynamics was in neurotoxicity and development productive toxicity in rodent, and morphology nerve change at dietary level. Analytical methods, two methods, main methods, LC mass masses and GC mass. The most important methods to deal with that. These methods were credible. They gave sensitive measures and sensitive data. It allowed to repeat the test with high accuracy. Other methods like NIR and tools to include immunoassay. Then occurrence data. There was difference in acrylamide level based on the type of foods or how it is treated, fried or baked. The foods included potatoes and coffee, but there was low acrylamide in other foods like fruit, chicken meat, and herbal tea. Dietary exposure. as mentioned, was different according to the nature of consumption. The average exposure was low, 0.2, 0.5 microgram per kilogram of body weight. But for infants and newborn, were more exposed to hazards because of acrylamide that may result in cancer risks. For risk assessment and margin of exposure, the risk was low to medium according to the type of consumption. Most exposed factions, risk management, there was complete elimination. Possible mitigation included process change like storage enzyme use and fermentation that needed monitoring ongoing in the EU, Canada, USA. And the recommendation was to continue risk management. The conclusion for recommendation, the main purpose was to continue the efforts on occurrence and exposure data collection and to update the toxicity data and promote mitigation strategy to encourage data and share them among countries. Next. The recommendation for Arab countries and delegation to encourage Arab countries to actively support and contribute EWG's work on revising the code of practice for acrylamide reduction. The recommendations for Arab region, 6 recommendations. First, to provide regional specific data and dietary exposure, reflecting the local food consumption pattern and processing methods. That was the reason. Based on the difference between countries and factions, it was requested to reflect more on local food consumption. The recommendation number 2, collaborate on regional research to better understanding acrylamide level and stable food unique to Arab diet. Number 3, developing culturally appropriate mitigation strategies such as adapting cooking method and ingredient substitution that align with local culinary practice. Acrylamide is one of the contaminants resulting from the manufacturing processing. If we are able to make adapting for cooking methods, this will be a tool for reduction for acrylamide. Next. Recommendation number 4, to establish national monitoring program to track acrylamide food product and to assess effectiveness of mitigation measures. Then organize capacity building initiatives and training workshops to strengthen expertise in acrylamide risk assessment, monitoring and control. Final recommendation, engage in international collaboration to share data, experiences and benefit from best practices with other countries. Thank you very much.